Good morning, good afternoon, good evening from wherever you are in the world, and welcome to this Global Compact Leaders Summit session. We will be focusing on South Africa, and we will talk about risk, recovery, resilience, and lessons learned from the pandemic. We will be speaking to you from CEO's perspective, business leaders in South Africa, and what reflections and insights they have from COVID-19 pandemic. Before I introduce our business leaders today, I'd like to briefly, just quickly talk about the Global Compact as a way of introduction. As you know, the UN Global Compact is the largest sustainability platform in the world, working to accelerate and scale the global collective impact of business by upholding the 10 principles and delivering on the SDGs. We do this through accountable companies and ecosystems that enable change. In South Africa, we have a significant and growing presence of companies committed to the Global Compact. And we do this through the Global Compact Network South Africa. Today at this Leaders Summit, it is important to share South Africa's business leaders' perspectives on the pandemic. And as I said, specifically on risk, on recovery, and on South Africa's resilience, and specifically on business resilience as well. And so I'd like to take a moment now to introduce, we have with us the CEO of Bidvest Group, Mpumi Madisa, with us. And we also have from Aspen Pharmaceuticals, Stavros Nicolaou, who is the group senior executive at Aspen Pharmaceutical in South Africa. And I'd like to start by saying a bit about Aspen before I then hand over to Stavros. So Aspen is a really important company in South Africa. And Aspen Pharmaceutical is instrumental in the fight against COVID, given that it's the only manufacturing site on the African continent and in the Southern Hemisphere selected by Johnson & Johnson to compound, fill, finish, and package the COVID-19 vaccine. This is a significant collaboration and a demonstration of how important partnerships and the SDG 17, which is about partnerships, is taking shape during this pandemic. Mr. Stavros, I'd like you to now take a moment and just, say a bit about yourself and about how Aspen has survived this pandemic, the contributions that you have made. I would also like you, within that introduction, to briefly talk about how you're using the SDGs in your reflections, in your strategy, in your recovery plans as you look into the future.
Good. So can I join you in saying good morning, good afternoon, and good evening, depending on which part of the world you're in and where you've tuned in from. Program Director, Madam, thanks very much for having us on this program in the first instance. And secondly, I think these type of interactions and engagements are critical at this point in time, because not only do they assist to understand the challenges and the issues that we're facing, not only in our own country, South Africa, but more broadly put in a global context. So this type of engagement is very important in understanding where we are at present with a pandemic, a very difficult set of circumstances. But I also think more importantly, the buzzword throughout this entire 15 or 16 month journey of COVID has been around strengthening partnerships. And I do believe this type of dialogue today will not only strengthen partnerships, but allows a re-examination of the SDGs as well. And there's probably no better time to look at, to reflect on the SDGs and also to see how effective as a global community and as a country we have been in implementing those when you stack those up against COVID. Of course, as you indicated, Aspen Pharmacare is a healthcare company, a pharmaceutical company. We are deeply rooted in both the geography and the fabric of South Africa, and more broadly the continent. We are a multinational company that has extensive manufacturing operations both within South Africa and also outside of the country. We have a manufacturing presence, a pharmaceutical manufacturing presence in all continents around the globe. But it's interestingly the South African manufacturing facility that has come to the fore during this pandemic, and to a lesser extent, our facility in France. Why have they come to the fore? During the first wave of the COVID pandemic, and of course, we still all have vivid visuals of the pandemic and how it unfolded in countries like Italy and France and Spain, where there were terrifying visuals coming out. Patients could not be ventilated, running out of oxygen. And those were harrowing visuals that largely actually shaped. My colleague Mpumi here was part of a business initiative that shaped the private sector's response to the pandemic in South Africa. But it's those very visuals that helped us ahead of the time look at how we could put a coherent response together with our own government. So during that time, Aspen's facility in France, which manufactures general anesthetics and muscle relaxants, all products that are required to ventilate patients, that became a very important facility. And we realized yet again, even as early as the first wave, how important it was to have domestic capacities to deal with pandemics and to generally deal with public health challenges. Because when this one goes away, there will be the next one. And what we know for certain is Africa has the most disproportionate disease burden of any continent in the world. And the best way to manage any disproportionality in disease burden is to prevent the disease in its first place. How do you prevent diseases? You vaccinate people. It's the most effective way of preventing disease is to vaccinate. So even in Europe, as early on as the first wave, as Aspen, we looked at the situation and we said, well, even Europe is running out of life-saving medicines needed for ventilating patients, many of whom had fallen ill and were in an ICU setting because of COVID. Let me fast track a little to the second, and now in our country in South Africa today on the 7th of June, we are well into a third wave. Unfortunately, we hope it's a muted third wave. We're at the start of the third wave, but we're in a third wave nonetheless. And of course, the best way to manage a pandemic of this nature is twofold. There's the non-pharmaceutical measures, which are the things we've been advocating, like social distancing, masking up, those sort of areas. We've been doing that as a matter of course. That's the one piece. And now the second important piece that is a real game changer globally and in our own country is to vaccinate the population to contain the problem or to achieve herd immunity. But in all of this, particularly in the last few months, we sit now in South Africa and on the African continent, again on the 7th of June, where there have been close to 2 billion doses of vaccines administered globally, and yet 1% of those have been administered to Africans. And if I look at our own country in South Africa, we've only managed to vaccinate around 1.4 million doses, or 1.4 million people have received at least a single dose of the vaccine. Now, juxtapose that against the close to 2 billion, you can see where the problem lies. That there's a disproportionality in vaccine distribution and administration. And of course, it's human nature. Every country is going to look after their own people first. It's a natural human instinct, I suppose. But that doesn't help us much on the African continent. And if we don't scale up our vaccinations, we are not going to meet many of the SDGs. At least 3 of the 8 of them will not be met. So where am I taking this discussion to? Because if there's anything that we've learned from this pandemic, and we've learned many different things, many of us on this call have learned, every day we learn something new. And every day when you learn something new, you realize how little you know, right? Unfortunately. But the one thing we know for sure is that Africa does not have capacity. It does not have capacity in healthcare systems, but also I'm sticking to vaccines for the moment. I'm adhering to that script. We import 99% of our vaccines into the African continent. So it's little wonder that if you don't have the capacity and you're largely dependent on imports and manufacturing jurisdictions elsewhere in the world, then of course you're going to be left at the tail end when it comes to the queue. You're not going to be at the front of the queue. Okay, so that is a big learning from this pandemic, and it's something that we cannot repeat going into the future. It's been particularly pleasing for us at Aspen because we're able to assist in that we have what we call fill and finish capacity. That means we receive the active ingredient of the Johnson & Johnson product. We have to thaw it, you de-thaw it, and then you put it into solution. It's called formulation or compounding. And then from there, you have the final vaccine solution. It gets filled into, literally like this, it gets filled into a vial. Each vial contains 5 doses, and then the vial is sealed with a rubber cap. It's melted and sealed. All of this is done under the utmost sterile conditions. And those sterile conditions are definitely not in an abundance on the continent. There's a dearth of that capacity and that capability on the continent. But at least we've started. We have some capacity. We need to build and expand on that right now. So what are the critical steps here, just to start winding down on this aspect of the conversation? Is firstly, we must build our own capacity on the continent. And capacity doesn't just mean fill and finish. It means becoming backwardly integrated into the active substance. The active substance, whether it's a pharmaceutical or a vaccine, is that part of the medicine or the vaccine that is going to exhibit the therapeutic effect. In this case, the prophylactic effect of the vaccine. We don't have that capability to manufacture the active substance. It's critical that we are able to have end-to-end value chain management and control on the continent. If you're missing that first step, the active substance, then you cannot really control the value chain, and you will have this dependence on other parts of the world to supply you with vaccines, and we cannot be in that position, as I said earlier. So the 3 things we need done here: number 1, we need technology partners. There's been a lot said and made of the intellectual property waiver that's currently under discussion at the WTO. Will be discussed later on this month in the G7 meeting. But that is only one step. What you actually need is you need practical solutions to all of these things. And a practical solution is having technology partners with capable technology recipients here in South Africa so that you can transfer those technologies and start producing your own active substance. So that's the first thing: technologies, technology partners, technology transfers, and also the know-how transfer is important in all of that. The second thing that we need is, it's no use developing capacity on the continent and you cannot sustain that capacity with sustainable volumes or offtakes. So you need sustainable demand and sustainable supply. And that has partly been one of the primary reasons why you don't find much of a pharmaceutical capacities on the continent, is because most of the procurement of drugs, vaccines in particular, let me just stick to vaccines for purposes of this discussion. Most of the vaccines are procured by either international procurement agencies, multilateral procurement agencies, such as Gavi or UNICEF, or alternatively, they are procured through donor fund agencies. Those donor fund agencies, et al., are not procuring those drugs from Africa. So we need a reconfiguring and a reorientation of both both procurement cycles on the one hand, and also the procurement dynamics on the other hand. So we have to say, we want our own capacity on the continent. We've demonstrated, Aspen is a good example of that, that we can produce these products on the continent. In fact, we, as you said earlier, yourself, Program Director, Aspen is one of the selected J&J contract manufacturers. We're the only one on the African continent, the only one in the Southern Hemisphere. So we have demonstrated that Africans can do this. And we've got both the competence and the expertise to do that. But we need to have sustainable volumes on the continent so that we can make these facilities sustainable. We don't shut them down in a year or two. And to do that, you have to say, well, a certain portion of what is procured is going to be given to African companies for that procurement to happen. Africa should also, as it is currently doing through the AVAT platform, that's the African Vaccine Acquisition Task Team, which the special envoy for COVID, Mr. Strive Masiyiwa, is heading up. We need to aggregate the volumes on the continent. We need to reorientate the procurement agencies to procure from African companies so we have the sustainability. The third and final piece I want to mention here is that, Africa doesn't always need funding. Okay, it's not about funding. Very often our companies, including Mpumi's company on this call and many others, have got their own balance sheets. They've got their own access to capital. Okay. What we do need, however, is if there are going to be global grants that are designated or handed down, then Africa should be considered as well. Good case in point again during this COVID crisis is that there have been grants given, but no grants to develop production capability or to develop active substance development. None of that has been given to African companies. So I think we're calling for some equality around that. We say, let's level the playing fields. We're not coming as beggars with, asking for handouts. What we are asking for is, we will demonstrate our capability. We will demonstrate our competence and expertise. And if you are going to be giving out grants to develop global capacities, then consider us as well, Africa. So this is my summary. It's been a very interesting journey, of course. We're extremely proud that an African company based here in South Africa, being Aspen Pharmacare, is producing COVID Johnson & Johnson vaccines, not only for South Africa and the continent, but for the world. And as it was pleasing for us to be able to assist the French and Italian governments during the first wave, it was again an African company that was coming to the fore and assisting European patients. So for us, it's not about, everything's about the patient here, but we need to solve these problems jointly, collectively, and as a global community. And we can't leave Africa out of that equation. We also cannot any longer entertain Africa being an importer of products and Africa depending on others to solve its own problems. We are saying, let's join hands, let's learn from these experiences, let's get the technology transfers going, the procurement cycles reconfigured, and let's start solving our own problems on the continent. Thanks very much for this opportunity, Program Director.
Thank you. Thank you very much, Stavros. And I'll come back to you in a moment, but let me go to Mpumi. Also CEO of a very important company in South Africa, I think one of the largest diversified companies in South Africa. I know that Bidvest Group employs over 130,000 employees. And so at the onset of COVID-19, Bidvest's focus immediately goes into how do we support our employees. Mpumi, I'm giving you an opportunity to just introduce yourself a little bit and tell us about that journey of Bidvest's response at the onset of COVID and the lessons that we can pull out of there. Your lessons around risk management, around managing for resilience and sustainability into the future, so that Bidvest can then, together with South Africa, withstand whatever other pandemic might come our way. Over to you, Mpumi.
Thank you very much, Dr. Ojwang. And yes, good morning, good afternoon, and good evening to everybody. Yeah, thank you very much for the opportunity. So as I've been introduced, my name is Mpumi Matisa. I'm the CEO of Bidvest. And yes, I think all of us, particularly in South Africa, will not forget the 27th of March, which is our day one of lockdown. And basically what happened for us within Bidvest is we woke up, and from the 27th of March, we had 75% of our businesses closed, essentially designated as non-essential. And for a business like ours that operates across multiple industries, to your point, we at the moment have just in excess of 200 businesses and about 130,000 people. What the lockdown in April translated into for us is only 25% of our operations open, alive, 75,000 people not working. So it was really tough. I don't think that in the history of this organization, we've ever had a moment and as tough decisions that we needed to make as we made in April 2020. And, you know, I mean, one of our big philosophies in the group is that our people are our most important assets. And so, you know, sometimes in the corporate world, that can become just a slogan. But when the chips are down, that slogan must translate into action, right? Otherwise, then it means that the organization has never really understood what that means and never really committed to putting people first. So in putting people first, our first priority was, how do we ensure that we hold those 75,000 people? How do we create a safety net for them? And to your point, the first thing that we did do is set up a fund, what we called our COVID fund, which is 400 million that we set aside so that we could provide some kind of additional salaries funding for our employees. I mean, South Africa, we had the UIF TERS benefit that government had set aside, and there were billions there that had been set aside, which is really phenomenal. But at the time, we were anxious because A, we didn't know when, you know, our employees were going to be able to access those monies, and B, whether the payments would be sufficient to cover as close to a full salary as possible. So it was important for us to make a decision that would create a safety net. And it's really been fantastic. So for our employees that were not working, or those that were on short time where we had to change hours in our factories, etc., between the 400 million fund plus UIF TERS benefits that were paid, we actually were able to give our employees just about full salaries during a very, very difficult time. And it's heartening for us to also still now, as we sit in June 2021, we still have some funds available. We still have businesses, particularly though the businesses that are facing industries that unfortunately haven't as yet sufficiently recovered. So your travel, your tourism, your aviation industries, those industries are still in some form of hard lockdown globally. And so our businesses that are directly interfacing those industries, we're still not 100% back. And so in those businesses, we continue to support our staff through the fund. I also want to also just point out that, you know, we took a view around making sure that we look after our people, but our people come from a broader society. And one of the things that we were very conscious of, and I mean, this again talks to the SDGs, is it's one thing to make sure that you're taking particular care of your own people and your own cohort that you're directly responsible for, but they go back into communities, and what about those communities? And so in tandem, we also had a very big thought process around, so what do we do from a social perspective? How do we help government to make sure that we create a social net that is sustainable during this time? And so we implemented a number of initiatives from an education perspective. Whilst we are now sitting on a platform where it doesn't matter where you are in the world, you're able to access this platform. The reality is that for majority of South African children, this access does not exist. And so as schools were closed, our biggest anxiety was also education in the class of 2020 and what would happen to those children. And so we were very clear that we need to work with government to ensure that children go back to school and that schools reopen as quickly as possible, as safe as possible. And so we partnered with the Department of Education across 8 of the 9 provinces in South Africa. We provided decontamination services, we provided PPE, we provided sanitizers, we provided a whole lot of services for free to ensure that schools could open. And when schools eventually did open, we were able to enable 1.2 million learners to return to school, which was important. And linked to that, because we also knew that in some schools there would be some form of a hybrid, we needed to ensure that in South Africa there's some universal access to education. We then partnered with the South African broadcaster, the national broadcaster, the SABC, to put the curriculum for matriculants on free-to-air television. And so we were then able, through that initiative, to also create access from an education perspective. We did many things. We distributed food parcels to 20,000 households in the country. And so we were very clear that there is a socio-economic requirement, need, that business needs to come to the table and assist. And of course, I mean, staff has said a lot directly from a COVID perspective. And Aspen being in the pharmaceutical industry obviously had a far more direct role. We also own Adcock. Adcock is within our suite of businesses, but Adcock doesn't play in the space of vaccines. But we also did our part separately, just from a supply chain perspective. So during lockdown, we were part of the supply chain work streams, deployed skills and experience to enable and help government and work with government in terms of opening up the economy. And today, as we're talking vaccine distribution, we also seconded some of our supply chain specialists in the group to assist in putting together a supply plan. It's one thing to have the vaccines, but if you don't have an efficient and an effective supply plan to ensure that distribution works and that the vaccine goes from point of storage to the end user, then that's also problematic. So, to Stav's point, I think the last couple of months have just really been about team sport and teamwork. I think it's one of the big lessons for all of us, both business and government. None of us had a pandemic on our risk register. And so it was also a time, I mean, I remember for me, at some point, it felt like you were building a plane in the air while it's flying. But it was also a time of really quick thinking and trying to make the best decision possible. But certainly for me, the biggest lesson has been, in a crisis, do not be insular. In a crisis, do not just look at your own organization. Be very cognizant of the ecosystem in which we live and think about your role in every aspect of the ecosystem so that everybody survives. And I think that's been an important lesson.
Thank you. It's very important that you both bring up the issue of why it's important, or why it was important for business to partner with government during a crisis. We are also talking about sustainability, so we are thinking long term. So it's not just about partnering for the crisis. How are your respective businesses going to take this forward based on those lessons? Is this going to be a continuing, embedded in the DNA of business, that we will, on a day-to-day basis, be partnering with government? And why is this important, today? Why is it important when you look into the future? Mpumi, you can go again, and then
okay, that's fine. Yeah. That's fine. Thanks, Doc. Yeah. So for us, interestingly, the partnerships with government didn't start now, and I suppose I've got a soft spot for it because I used to work in the public sector. so for me, you can never, as an organization, work outside of government. There's this partnership which is necessary, whether there's a crisis or whether there isn't a crisis. And so I've constantly always been in work streams where we're figuring out complex country problems for the country. So for me, it'll certainly continue. I serve on Business Leadership South Africa. I'm on the board, and through BLSA, we very directly engage with government and co-create, co-solve, co-think, and talk about issues around broader long-term sustainability for the country. So it's important, and it comes back to the initial point I made around the fact that you can't have an insular view. That what makes up a country is not just government, neither is it just business, and neither is it just society. It's the collective, and our ability to work together is important. Personally, from a Bidvest perspective, one of the things that we have also done is we've taken this time to think about some of the structural inequalities that have really just been elevated because of COVID, and are putting together, unfortunately, I can't announce them as yet, but are looking at programs that we will be announcing towards the end of the year, just to tackle some of the structural economic inequities in the country that exist. And in some spaces where really they're the responsibility of government, but they're just to such an extent that it's been hard to eradicate some of those inequalities over the period. And some of them, the areas that we're picking, are just exacerbated by the pandemic. And so in both those instances, we'll be working very closely with government, but around long-term programs and long-term sustainability in terms of just closing out some of those gaps. So 100% absolutely agree with you. It's a team sport, and it's not a team sport just because there's a crisis. When we build a country, we must build it together. And if we want social cohesion and sustainability going forward, it's an imperative. It's not even an option.
Thank you. Stavros, on these partnerships that have emerged or have been strengthened during the pandemic, what's Aspen's perspective going forward, especially within the context of being able to anticipate risk and building resilience for the business?
Earlier we were speaking about the many learnings, right? That we've all learned many different things, and even the way our businesses look today are fundamentally different to the way they looked 15 months ago. And I'm afraid there's no going back, I think, entirely to where we were 15 months ago. We're seeing digital and online applications. We're seeing new measures of productivity and the likes thereof. So the world will never really be the same for any of us again after this pandemic. And for us, part of the learnings as Aspen have been, once again, to reinforce the importance of partnerships and collaboration. There are many different examples of how the private and the public sector have collaborated in recent months, successfully so. And I think we need to build on that. So that certainly is a pleasant learning that you take out of this. So there's no doubt that the best way to solve problems, societal problems, economic problems, is unless you get both the private and the public sectors completely aligned and pulling in the same direction, you're not going to succeed. So I think that has been a good learning, and one that certainly the country will be taking forward. And it's something that we fully endorse and subscribe to as Aspen. Aspen, by its very nature, being a healthcare pharmaceutical company, we, in any event, are required to have a strong interface with the regulators, with the health department, and many different parts of government. And what this pandemic has done is perhaps given, first of all, an urgency to that moving forward, because sometimes we don't always appreciate the urgency. And we talk a lot and we put out documents and policy documents one after the next. But you can only really implement on these and execute on them if you've got a government and a private sector that are in sync. And that is also the Aspen philosophy, is let's work together with government. Certainly there are parts where government needs to lead and continue leading, and the other parts, where the private sector will lead. So that has certainly been a very good learning, and one that will hold us in good stead moving forward. I think the other thing, when they say a necessity is the mother of invention, right? How many times have you heard during this crisis that never let a good crisis go to waste? It's sounding a bit cliche, right? But I think never a truer word could have been spoken, to be honest, because what this has done is it's turned our attention to more innovative approaches to solving problems. And that's why I'm going to go back to, and I think, being at Aspen, being in the pharmaceutical industry, we are in a privileged position because there's no time like a pandemic to make an impact. And I think we've made an impact, as has Mpumi's company also made an impact. She's got subsidiaries of Bidvest, Adcox, and others that have also made an impact. But I think the good thing is it's given us an opportunity to have a look at what is the best way of innovating, because you can many different ways of looking at finding solutions. So, for example, what we were speaking about earlier, technology transfers and finding technology partners, that allows you to leapfrog many of the barriers I think that you would have encountered. Have you just said to companies, well, you go and find the solution to the problem on your own? They don't have that capacity. So what I'm saying here, in the midst of partnerships, is certain companies have got strengths and others have got weaknesses. And it's how you complement those different strengths. So Aspen has a very strong manufacturing capability, but we don't have an R&D capability. So finding a partnership with technology partners that gives you access to the technology so that you can properly solve the manufacturing piece of the puzzle is a very important consideration moving forward, and one that we need to continue building on. So a new way of innovating, a new way of partnerships, and a public-private partnership moving forward are some of the most important aspects to take us out of this pandemic and further into the future.
Absolutely, you bring an important point of innovation. I think this applies across companies. Regardless of what they do, innovation is what is going to be able to take us forward. Before I go back to Mr. Rose, you both actually sit on Business for South Africa, the body that business formed to collaborate with government in the national response to COVID-19. The reality is that South Africa has been very slow in administering the vaccines. And I know you talked about vaccine inequality as this global phenomenon that we have to address. That has slowed us down in South Africa, and I think it is a fact. How is this exacerbating risk and our recovery process, and what is it that you'd recommend that South Africa, do to recover a lot faster, Stavros?
Firstly, you're quite right that recovery in the economic sense is largely dependent on how quickly you vaccinate your population in this instance. I mean, again, one of the best things I've heard this year was a CEO who was quoted at the Davos World Economic Forum, where they asked him, what is the best economic policy for the world to follow in 2021? You know what he said? He said the best policy is vaccinate, right? So he was quite correct in saying that, because when you vaccinate sizable parts of the population, you've got a mix of natural and vaccine created immunity. When you've got that, you can start opening up your economy again. You can start trading with international partners. You can start getting people flying in and out of your country. Conversely, if you're a laggard in that area, countries are not going to want to, in the short term, trade with you. You're not going to have the tourists coming in. You're not going to have the business people flying in. So it is critical, as you say, that we vaccinate as many people as quickly as possible. Now, it is true that right now we haven't vaccinated enough people in South Africa. And there are many reasons for that. There's been a number of setbacks, including a dominant variant that we experienced in our country. That meant we had to change right at the beginning of our vaccine rollout program. We had to shift entirely into a different vaccine regimen, which is most unfortunate. Not many other countries were in that type of situation. And it did require us to pivot, and we did pivot. We were managed to bring in what we call the Sisonke program, which was a clinical trial study. It was the only way we could pivot into Johnson & Johnson vaccines, so at least we could cover our healthcare workers. So you're correct in saying that we haven't vaccinated as many people as we want to, but there are some important things that we have done. First of all, I think how we've managed the pandemic and how we managed, for example, the second wave, and how we were able to bring it down through non-pharmaceutical interventions. I think that was very well done by the country. I think secondly, we have vaccinated a sizable portion of our healthcare workers. That was very important for us to do before or at the onset of the third wave. So that has happened. So many of our healthcare workers are going to now benefit from being vaccinated. They would previously have been fully exposed in the heart of winter and at the onset of a third wave. So I think those things have been well done. I think what we need to do is look at where the country is in September, by the end of September, because we had always planned as a country to vaccinate our healthcare workers, our 60 years and older population. We look to do that by the end of July. We will come close to achieving that by the end of July. And then I think we have got capacity in the private and the public sectors. And this is where Mpumi's point is very important. We have worked together, private and public sector, through the Business for South Africa platform. We're working seamlessly. One objective, one mission, and that's vaccinate as many people as quickly as we can. And through that, we will also get to our next band of vaccinated patients. That's your 40 to 59-year-olds. And we could look to do that by September. So we quite possibly could be in a good position by the end of September.
Thank you. Thank you, Stavros. Yes.
Thank you.
We're running out of time, and I want Mpumi to come in from a supply chain perspective, because within Business for South Africa, Mpumi sits on the supply chain working group. What could we do differently to recover faster as a country?
Yeah. So, I mean, from a supply chain perspective, if you increase your points of supply, it's mathematics, right? Increase the points of supply, you get to more people. And so, I mean, really, that's what we need to do. And to Stav's point, it is part of the plan. So one of the things that we haven't gotten to yet, and this will start seeing some of our numbers go up quite significantly, are occupational sites have not properly been activated as yet. There are many companies that have registered, that have got employees that are paying for vaccines, etc. The mining industry in particular has got a big number of people. They've got clinics on sites, etc. If we can activate some of those sites quickly, we'll be able to put our reach on steroids. That's the first one. The second part that we're seeing globally, and we're not there yet, but it is part of the planning process, is the mass sites. So globally, you see how stadiums have been converted into mass vaccination sites. We've got a plan around it. They will come on stream. And once you're able to get to sites that can do a couple of thousand people per site per day, then again, you kind of put your numbers on steroids. So it's really around the numbers. The plans are there. It is coming. Unfortunately, we've got a bit of a time lag to it. But from a supply perspective, if we increase the number of points and the capacity at those points is much bigger than current capacity, we'll be able to get some better traction than we've seen. And all of that is in the pipeline and will come on stream.
Thank you very much. Let me take this opportunity to thank you, Mpumi and Stavros. We ran out of time, and really, really great perspectives and lessons from South Africa. I think the issue of partnerships with government and with other stakeholders is really the biggest lesson I think we take out, but also the issue of capacity for South Africa and for the global South and for the African continent to be able to have that capacity to manufacture our own vaccines, to get the technological transfers, as Stavros has said, is really, really critical. So I want to thank you very much for joining us at this Leaders Summit and for bringing South Africa's perspectives to the world. Thank you very much.
Thank you very much, Dr.
Dr. Arjoin, thank you very much.
Thank you. Thank you. Have a great day.